I would like to welcome the witnesses to our virtual meeting today. Thank very much the Secretary of State and Minister for Women and Equalities, Liz Truss, for joining us, and to her Private Secretary, Helen Cook. I would also like to thank Bowtie TV and the Parliamentary Broadcasting Unit, who have given us so much support to make today's meeting possible. Secretary of State, we were expecting our first session with you to be an introductory meeting that would cover a wide range of issues to do with the Government Equalities Office and your role. Unfortunately, the reality is that the majority of the meeting will be taken up talking about coronavirus. But I wanted to start with some more general questions and to give you the opportunity to outline what you think has been your biggest achievement since taking the role up in September of last year, so just over 7 months ago, and to let us know what your biggest priority is going forward.
Thank you very much, Caroline, and thank you to the committee for convening today. As you rightly say, the work of the Government Equalities Office at the moment is extremely focused on COVID, making sure that we're dealing with the immediate equalities issues during the crisis, but also making sure that the recovery we're planning benefits all across our nation equally, which is a key part of the government's levelling up agenda. In terms of my work as Minister for Women and Equalities, we have 3 key priorities. First of all, reshaping the Government Equalities Office and bringing it more closely together with the Cabinet Office unit, so the Racial Disparity Unit and the Disability Unit, to create an equalities hub. My intention is to move the department physically so that all of those people are sitting together, and also to bring the work more closely together, because I think we need to move away from the idea that we're simply dealing with groups that need to be catered for, and instead make sure that we're looking at individuals across the country and really identifying who are those most in need, where are the biggest barriers to success, and where are the unequal delivery of public services. So I want the unit to become much more focused on analysing that data, looking at it very closely, and then working to a hub and spoke model with the rest of government, so whether it's the Home Office on issues of crime, whether it's the Department of Education on issues of education, implementing those policies. So that is the change that I am making to the Government Equalities Office, and indeed the whole Equalities Unit. I'm working very closely with Theo Agnew in the Cabinet Office to do that, because I want our policies to be focused around individual dignity, individual opportunity, and we need to look really at where the biggest barriers are. And I would like to see us working more closely on issues like geography, so where are communities being held back, and also on issues of background, income, as well as issues of gender, race and disability too. So we have a much more holistic picture. So that's the overall direction in which I want to take the Government Equalities Office. A particular focus is going to be women's economic empowerment. And I think this will be particularly important as we leave the immediate issues of COVID and then to the recovery. Of course, we've had success in terms of getting more women employed ever before in the UK, but it's nevertheless the case that women are significantly behind comparative countries in terms of setting up businesses and entrepreneurship. We know that it would contribute 10% extra to GDP if women had the same levels of participation in entrepreneurship as men. And one of the things we've done so far is we've hosted a major reception at Number 10 with women entrepreneurs and leading women to move that agenda forward. But I'm very pleased to say that as a result of the recent reshuffle, we now have Kemi Badenoch supporting me as Equalities Minister. She's based at the Treasury, which is obviously extremely important in terms of that overall economic agenda. So that has been a major focus. The other area we're focused on is our international work. So we were planning to hold a international LGBT conference in May. Regrettably, that's had to be postponed due to coronavirus, but we do want to hold that conference as soon as possible. We'd already made significant plans with Nick Herbert to chair the conference, the theme of Safe to Be Me. And that is very much about using the UK's strong record in terms of LGBT rights and human rights to make that case across the globe and make sure that wherever people live, wherever LGBT people live, they're safe to go about their daily business without fear of crime and harassment. And that is also a very important priority. I've already participated in an event, in fact, in Tokyo, launching the Asian chapter of that initiative. And that's something we want to pursue further. The final point I'd like to make, Madam Chairman, in this initial part is on the issue of the Gender Recognition Act. We've been doing a lot of work internally, making sure that we're in a position to respond to that consultation and launch what we propose to do on the future of the Gender Recognition Act. We will be in a position to do that by the summer. And there are three very important principles that I will be putting in place. First of all, the protection of single-sex spaces, which is extremely important. Secondly, making sure that transgender adults are free to live their lives as they wish without fear of persecution, whilst maintaining the proper checks and balances in the system. And finally, which is not a direct issue concerning the Gender Recognition Act, but is relevant, making sure that the under 18s are protected from decisions that they could make that are irreversible in the future. So I believe strongly that adults should have the freedom to live their lives as they see fit. But I think it's very important that while people are still developing their decision-making capabilities, that we protect them from making those irreversible decisions. So, of course, some of these policies, Chair, have been delayed by the specific issues around COVID, but I can assure you that alongside the COVID work, our officials continue to do those things to make them happen.
Thank you for that. Can I ask about the time split of your two roles, the Secretary of State for Department for International Trade and Minister for Women and Equalities? Are you able to give us an indication of how much is spent on each role?
It's I haven't filled in a timesheet, so it's a slightly difficult question to answer. And much of the work I do, for example, during COVID, I'm sitting on the Economic Committee, and I sit on the Economic Committee both in my role as Trade Secretary and in my role as Minister for Women and Equality. So I'm looking at things from both angles. And that's what I try to do with my role when I'm traveling internationally. I conduct a number of meetings specifically on the women's brief, but often they will coincide with my trade brief. So, for example, the Australian Foreign Minister is also the Australian's Women's Minister. So during a meeting, we will talk about those issues. And I think that's the right approach. I know there are some people who would say, well, we need to have a separate women's minister and a separate women's department. But I do not think that is a helpful approach, because that, in my view, lets other departments off the hook for looking at equalities issues. What I see my role as is making sure that the education department is looking at equalities issues when they do the work, making sure that the health department is likewise looking at that. And I think if you have a separate dedicated women's department, there's a tendency for other departments to say, well, that's the women's department's problem. I'm not going to think about those issues. So I don't have a specific time that I could outline that I spend on this role. Meetings tend to be sort of diarised in a very, in quite a fluid fashion. And if you'll appreciate, since I started the role of Women's Minister and indeed Trade Secretary, we've had an election and we've also had the COVID crisis. So necessarily, we've been focused on different issues. But I certainly feel that with me and also the team I've got of Kemi Badenoch and Baroness Berridge, we're well able to make the important points that need to make in the time available.
Can I just ask, do you regard it as part of your role to raise the profile of the Government Equalities Office, and particularly the work that you do for women and equalities?
I see my role as making sure the outcomes are better for women, ethnic minorities. As I've said, I want us to look more broadly at issues of geographical problems, of issues of discrimination against people of particular backgrounds. So I want to move beyond what are termed the protective characteristics in terms of the 2010 Act and look more broadly at where are people being held back by discrimination or by not having those opportunities. And, to me, if there is some policy that we are putting forward, so for example, the Home Secretary, I think made a very good announcement in terms of the You Are Not Alone campaign on domestic violence, which clearly disproportionately hits women. Now, we will work to amplify that at the Government Equalities Office, and we certainly do. But it's right and proper that should be a priority of the Home Secretary. And I want a whole government approach to promoting equality of opportunity and lack of discrimination for everybody. I don't want it to be seen as the sole responsibility of the Government Equalities Office.
I'm glad you mentioned the Home Office You Are Not Alone campaign, very important campaign. Some of us might think it was a bit slow off the blocks, given what we know has been a spike in domestic abuse. But can I just ask on that, you regard it as your role to amplify that, yet over the course of the last 42 times about trade, 5 times about Norfolk in your constituency role, twice you've retweeted information about domestic abuse from the Home Office campaign, and only once have you mentioned the wider work of the Government Equalities Office, and that was to congratulate Marsha de Cordova for being your shadow. You regard yourself as a prolific tweeter, boast of having one of the highest social media presences of any minister. Do you think that's enough?
I don't think you can measure work output by number of tweets. I mean, a lot of the work I do as Women and Equalities Minister is necessarily internal, because since the start of the COVID crisis, our department has been supporting other departments in terms of their equalities and impact assessments, making sure that they are doing the work to ensure women are being treated fairly, BME communities are being treated fairly, LGBT communities being treated fairly. And I think that it is important that those departments take ownership of those roles. And of course, I worked in support of Pretty and the excellent campaign she's launching on domestic violence. But I don't see, I see that as very much the Home Office leading that work and GEO encouraging and supporting that work, rather than GEO should be the headline department in doing that. I mean, the aim of the department isn't to aggrandize the department. The aim of the department is to make sure that across government, we are achieving what we need to in terms of opportunities for people who have been discriminated against, where there are barriers to those people's success. So I think it's right that we are working strongly internally to make those things happen. Of course, I will tweet about things as they happen and do. And one of the points I made earlier, Caroline, is about how we are refocusing GEO to spend more time on research and data so we can help inform government departments in their activity. And that's something that I want to build up strength in.
Can I ask specifically on the question of the domestic abuse campaign of the Home? Prior to the press release being issued, exactly what involvement and what input had you had into that campaign?
So I discussed it with the Home Secretary. My SPADs discussed it with the Home Secretary SPADs, and the GEO have been very clearly working on it.
Thank you.
But ultimately, it's a very important point to make with respect to all departments. They are responsible for dealing with their direct policy issues. And I think it would be wrong for the GEO to seek to replicate that policy work. That's specifically what I don't want. And that's why I see GEO working in a hub and spoke model where we're there to provide advice, but the department themselves are responsible for implementing the policy.
It would be interesting for us to see some of the advice that the GEO had provided. You said that you sat on the economic subcommittee dealing with COVID. How do you think the health issues of BAME people are best represented without you having an input into the health subcommittee? Or do you think when it comes to public sector preparedness, and particularly the very serious concerns there are about elderly people in our care homes, you're also missing from the subcommittee chaired by Michael Gove? Do you think actually, as the Minister for Women and Equalities, there should be a role for you to sit on more than one of these committees in order that the GEO's voice can be heard?
So I do sit on two committees, Chair. I sit on the International Committee and on the Economic Committee. And in terms of the data on ethnic minority issues, specifically in terms of the COVID disease itself, that is something that we've been directly in touch with PHE and the Department of Health on. So I have asked that we get better data on exactly what is happening on that issue, and we get in touch directly with those departments. Likewise, on the issue about the age effect, that is stats collected by the ONS. I'm also working with the Disabilities Unit in the Cabinet Office to get better data on exactly how disabled people are affected as well. But I think there's a balance between sitting on committees and being able to get work directly done with departments. And I feel the Economic Committee is a very important one. It's going to be really important in terms of the recovery. And one of my concerns is making sure that we don't, we've already got a good record of women employment. We don't slip back in that. We make sure that women are properly supported as a recovery takes place. But on all those other issues, as they come up, I deal directly with departments, and my officials deal directly with departments on those.
Can I just ask a specific question about the Coronavirus Act and the temporary legislation and how you fed in to the process? I note that the Equalities Impact Assessment hasn't been published. Are you going to publish it? Do you think it should be published? And are you expecting there to be further equality impact assessments undertaken whilst the crisis is ongoing?
The assessment was made in conjunction with support from the Government Equalities Office. So we were involved in the composition of that assessment, as we always are. And we work to support government departments in carrying out their equalities impact assessment. It is important to note that it is their responsibility to do that. And this is my point about mainstreaming equalities work. It's not the responsibility of the GEO. We can help and support departments, but it is ultimately their responsibility to do that work. In terms of publishing, I just wanted to answer your question, Chair, about publishing that impact assessment. I think the problem is when these types of assessments are routinely published, the people who write them tend to check themselves. There can be a chilling effect on being frank in those assessments if they are then subsequently published. So these are internal documents to help inform the government about how we operate. And I think the more that those documents end up getting published, it's more difficult for people to be frank in those documents.
And are we going to see you make an appearance at one of the daily press conferences? It's been really noticeable so far that they have been conducted by men. When's your turn?
The Home Secretary has already made an appearance, as you'll be aware. As you'll be aware, at the daily press conference. And there's also been appearances by senior medical officials, such as Dr. Jenny Harris has appeared at that conference as well. And you'll be aware that women are playing a key part in the response. Therese Coffey, the Secretary of State for Work.
Not seen her either, though, have we?
Well, she's done a number of media appearances, and I think she's doing an absolutely brilliant job of dealing with the increased number of universal credit claims. I know you previously worked in the Department of Work and Pensions, and it's tough to make sure that all of those things happen. I think she's doing a fantastic job.
We're not here to talk about what Therese is doing. Are you or Therese going to appear at those daily press conferences? Appearance once by one woman.
I was about to make a point, which is that I don't like tokenism. I don't like the idea that somebody should just appear at a press conference or in a media interview because they're a woman. They should be doing that, and they should be doing the work internally because of the merits of what they're capable of. So
So they shouldn't be there just because they're a woman, but you have a remit for elderly people, for the disabled, for those from a BAME background, for the LGBTQ community, a massive group of people who are being impacted by COVID-19, and you think it would be tokenism for you to appear at one of those press conferences?
I'm not saying that at all. What I'm saying is the excessive focus on what gender somebody is rather than what they do does a disservice to women, rather than saying that I believe that women are equally as capable as men, that we need more women in politics, that we need to, I think there are opportunities out of COVID to do things like make our parliament more flexible, get more representation. But I think we should be focusing on the right people to present at the press conference. Clearly, the major
not you issue, then? Are you not the right person?
The major issue at the moment is health. And so I think it's right that the health secretary is doing a lot of the press conferences and explaining the specific health issues. I am working, believe me, I'm doing a lot of work, as are ministers right across government, responding to this crisis. And there are important jobs to be done, whether that's working on committees, whether it's...
You told us earlier that you weren't keen on sitting on committees.
Sorry? I'm saying I'm keen on sitting some committees. I think I draw the line at sitting on all the committees, Caroline, is what I'm suggesting. But everybody is working extremely hard to deal with this crisis. We've got great women in lots of key roles across the government. We've got great BAME people in key roles across this government. What's important is the best possible response, because ultimately what women care about, what BAME people care about, what gay people care about is, do we help people stay alive, and will people have jobs and an economic future after that crisis? That's what's important. And I just think an excessive focus on precisely who is appearing at a press conference is the wrong focus.
Before I bring Nikki in, can I ask on that specific point that it's important that we focus both on keeping people alive and that they should have jobs at the end of this crisis? You're described in the media as a hawk. Is it more important that people should have jobs or that they should be kept alive?
Well, firstly, the most important thing, and as it says on our strapline, is that we save lives. That is the number one priority. We will not lift lockdown until we have fulfilled the conditions of those 5 tests. That is incredibly important. But of course, at the same time, it is right that we prepare for the lifting of lockdown and make sure that it has the minimum economic damage that we can deliver. And what I'm very concerned about is to make sure that minority groups, women, do not lose out as we lift that lockdown. And I also think that the change in culture that we've seen during this lockdown, although it's clearly incredibly tough for many families across the country, we've talked about concerns about issues like domestic violence. There are also some positives in terms of increased flexibility of working. A lot of employers who previously said people couldn't work from home are now finding that they can absolutely deliver from home. And I think we should take the opportunity to capitalise on some of those cultural changes that have happened to make it easier for people balancing family and career to work from home, to make it more flexible and to challenge the culture of presenteeism, which has been very alive in business and has also been very alive in politics. I think some of the changes we're seeing in Parliament are positive. So I do think that as GEO and also the Select Committee can have a role in how do we use some of the changes that have happened as a result of COVID to change our working culture.
Fabulous. Can I bring Nikki Aitken in, please?
Thank you, Chairman. Thank you, Secretary State, and I absolutely endorse what you've said earlier about the whole of government approach to women and equalities work. I think you're right that it has to be across the whole of the government, not just one department. I was really interested to hear what you were saying about the Safe to Be Me campaign, which I absolutely welcome, and the work you're concentrating on international LGBT rights. Obviously, we are part of the Commonwealth, and the Commonwealth, many countries, particularly in Africa, do have laws that outlaw homosexuality. How is your work and the international conference and this whole agenda for you? How are you liaising with Commonwealth countries and trying to get them to understand the importance of LGBT rights?
Well, that is one of the key purposes of the conference, is to invite those leaders and representatives to London. We're working very closely with DFID and the Foreign Office on this, and to make the case for the elimination of persecution of gay people in those countries. And we're making significant progress. Baroness Berridge is leading on this work, and she's already had some very positive conversations with Commonwealth nations. But I think the UK really has a very strong role to play. It is we are a great country in terms of our record on human rights, on LGBT rights. And this to me is about bringing other countries with us, showing that leadership, showing what can be achieved. And that is very much the aim of the conference. As I've said, we are trying to get a new date at the moment. I hope that we'll be able to have the conference early next year, so we can make progress on this really important agenda. But Nick Herbert, who is our lead on the conference, has already been doing a lot of outreach work around the world. As I mentioned, I did an event with him in Tokyo, where we were specifically talking about this issue. So I think the more that we can build up support, the better. But to me, this isn't a sort of name and shame campaign, if you like. It's much more about trying to get consensus, bringing those countries with us so we can achieve more together.
Thank you. Are you happy there, Nikki?
I just wanted to ask, I've come back with a very quick follow-up. Thank you very much, Secretary of State. Obviously, wearing your international trade hat, would you see there being issues with us setting up trade agreements with countries, particularly Commonwealth countries, that were not adhering to our views on LGBT rights?
So the way I see it, and I would say the same about issues like climate change, is that what we should seek to do is have tracks dealing with issues of climate change, issues of LGBT rights, but we should treat those separately from trade agreements, because we already trade with most countries in the world anyway on WTO terms. We have to, as a member of the WTO. And what trade agreements are really about is mutually lowering barriers and enabling more trade between our countries. That trade leads to economic development in those nations, which can often have a positive effect in terms of attitudes to LGBT rights, attitudes to women's rights. So, another issue I'm looking at is women in trade. If I take the example of Rwanda, 80% of cross-border trade is conducted by women running small businesses. So what I don't want to do is hold back potential benefits for some of the most, some of the poorest people in the world, because we are seeking agreement with their governments on LGBT rights. I think we need a twin track approach of encouraging economic development at the same time as working closely with those nations to move in the right direction on LGBT rights. And I think I take a similar approach to climate change. We've got the COP26 conference we're hosting. Yes, it's important that we seek global agreement, but trade is a good thing in itself to actually improve outcomes for people in those countries. And the evidence is that trade often benefits the poorest in society, most benefits women in particular, particularly in Africa. And so therefore, I don't think we should hold back our trade agreements because we're also seeking agreements elsewhere.
Thank you. Can I bring in Nicola Richards now, please?
Thank you, Chair, and thank you, Secretary of State, for joining us today. I just want to ask, going back to talking about the coronavirus pandemic, and I want to know, has the government made any assessment of why more men are dying from the virus than women?
We do collect data at present on men and women, and that's already being collected by the ONS and Public Health England. I don't think we do know the full reasons, but that is something that is currently being investigated by the Health Department. And as I said earlier, we're also looking for that other data, specifically on BAME, on the impact on disability as well of the disease. But I think it's fair to say that, across the board, we are working hard to find out more about COVID-19, but it's a relatively new disease and a lot more work needs to be done.
Thank you. And so if the government's tracking the number of deaths and infections by gender, which I think is what you've just said, do you know what's being done with this information so far?
Well, the information has been published in its broadest form. I think we're looking at getting the data in a more usable format at the moment. And as you rightly point out, just finding out why it is.
A large majority of the health and social care workforce and are such likely to be at much greater risk of exposure to coronavirus. What is your role in understanding the potential differential effects on the virus on women as well?
So, first of all, people in the health service are doing a fantastic job, and you're right that the majority of them are women, and it's incredibly tough. People are working round the clock, and we have huge respect for what they're doing. And we're doing all we can to get the necessary PPE, make sure that they have the necessary protection. And huge applause for the fantastic work those individuals are doing in our health service and all sorts of other jobs on the front line. So whether it's in care homes, supermarkets, I think we've all been very humbled and impressed really by the huge capacity of people to go out and work in these really, really difficult conditions. We are doing all we can through the Department of Local Government, through the Department of Health, to support the most vulnerable, to make sure people have the right possible protection. Of course, as I mentioned earlier, we have supported departments in carrying out Equalities impact assessments and making sure that where possible, we really are helping the most vulnerable in those situations. But you are certainly right, 77% of the NHS workforce is female. So, of course, that's an issue of particular concern.
Thank you. Are you able to tell me any steps that you've taken directly so far to protect women in particular?
The way I look at this, and this is what I was saying earlier, is that the Department of Health is the responsible department for making sure that they protect everybody who is working for the health service. And of course, a disproportionate number of those are female, as you rightly point out, but it's the same protection that is required regardless of what gender you are. It's just making sure that everybody has that protective equipment. And that's what the Department of Health is absolutely making sure is happening every day during this crisis.
Okay, thank you, Chair. Thank you, Secretary of State.
Thank you. And I'd like to bring Nikki Aitken back in on this topic, please.
Thank you, Chair. Looking at the economic impact on women in particular, I know it doesn't, it affects many others, but in women, they're very much involved in the care industry. 77% of NHS staff are women, retail staff. So there's a huge economic impact for women because of the COVID-19 crisis. So what have you been doing, Secretary of State, working with the DWP in particular, but other departments to really help and understand the economic impact on women during the pandemic?
So, you're right that these sectors, which are absolutely critical to the COVID response, have large female workforces. I do go back to the point I made earlier. The issues that are affecting them are affecting everybody, and that is why we're working so hard to make sure that they've got the protection, that they've got the support to continue with their jobs. I think there are broader questions as we emerge from this crisis. First of all, about how do we help women stay in roles? Much of recent employment is women gaining employment. How do we make sure that happens? How do we help women with startup businesses and new businesses? So women are twice as likely to run tech businesses as they are to run bricks and mortar businesses. One thing we know is technology is actually one of the sectors that has been less likely to be affected by the lockdown, due to the fact people are able to work from home, etc. But how do we support women in those types of businesses? How do we rectify the issue that there are fewer women entrepreneurs and male entrepreneurs? I think those are issues that we are going to be looking at as we go into the recovery phase, as well as the whole issue of occupational segregation. Why do we have a gender pay gap in this country? It's not because employers are paying women less than men for the same job. They're not. That's against the law. It's because we've got occupational segregation. Women have tended to go into particular types of careers. Men have tended to go into other types of careers. So how can we make sure that people have opportunities to go in every type of career, and we don't have those levels of segregation, at least not by bias, if you like. It should be by the choice of people taking up those jobs. So I think those are all questions for the future of our economy. And I think it's very important that as we leave the immediate COVID crisis, we're looking at how can we get women into jobs with high productivity, high wages. How can we make sure that people are properly rewarded for the work they do?
Thank you. You mentioned that it's against the law to pay women differently to men doing the same job, but we have had too many examples, even in recent months, where women have discovered that they're being paid less than men in the same job. What can we do to ensure that that doesn't happen? How can we ensure that particularly now during this pandemic, that companies are held to account and that they do their own audits to ensure that women and men are being paid for the same job?
Yes, I mean, you're absolutely right that this is against the law, and it's absolutely the responsibility of companies to make sure they are paying people correctly. And it's something we're looking at, as part of the work we're doing on the gender pay gap, to make sure that we have the proper enforcement processes in place. And in fact, I'm speaking to BEIS ministers about how we do that, because what I want is that type of work to be mainstreamed into the overall contact that we have with business, because we are working very closely with business during this crisis. I think many businesses have responded really well. If you look at the way the supermarkets have responded in terms of helping key workers shop at particular times, making sure that they are getting deliveries out to people who are being shielded. But we also need to work with companies as we come out of the COVID crisis to make sure that they are treating people fairly, and also that we are building up those high productivity jobs of the future and making sure that those jobs are accessible to women and ethnic minorities. As I said earlier, a large cause of the gender pay gap is pay segregation. Occupational segregation. It's fewer women in STEM jobs. It's fewer girls studying those subjects, ultimately leads to those issues in the future. So I think there is an opportunity here for a reset, as we have had a lot of change in culture of the way people work. And there's also occupational segregation with respect to part-time work. Yeah. The full-time gender pay gap is a lot lower than the part-time gender pay gap. And I think there are going to be fewer excuses for employers to claim that people can't work flexibly or part-time in jobs now, because people have seen it work. And I've had a lot of employers who I've been doing roundtables saying to me, actually, we're finding that people are more productive when they're able to control their own timetable and work from home. I mean, who knew? But I think there's been a sort of eye-opening moment for many employers on this.
Great. And just finally, before I pass it back to Chair, obviously the gender pay gap is a concern for you. It's obvious from what you've said to us today. What have you done in your own department to ensure that, that you're confident that there isn't a gender pay gap in your own department?
So what I want to do in the department, I mean, GEO, as I've said, we're making various reforms. So we're moving the department under one roof at the Cabinet Office. We do have a strong female leadership team, in fact, at GEO. In terms of the Department of Trade, we do have a female permanent secretary, but I'd also like to see more female leadership at the next level down in Department of International Trade. And we're looking at how we can promote more women into the department.
And you're confident that they're being paid what a man would be paying if they were doing the same job?
Yes.
Good.
I'm confident that, I think this is the issue for many organisations. It's the distribution of women around the organisation. So we've got more women in junior ranks, but not enough in senior ranks. And I think that is another reason for the gender pay gap, along with occupational segregation, as well as obviously the big issue around having children and the so-called child penalty. And I really do think that we need a culture change towards flexible working. And I think that we shouldn't miss the opportunity that we've seen now of people being able to work more flexibly and actually implement that in the workplace. I mean, for example, the Department of International Trade and GEO both went 100% to home working 4 weeks ago, before the lockdown was put in place, and it's worked very well for us. And I think government departments can learn from that.
Thanks, Nikki. Just following up on Nikki's question, a quick one from me. So what have you done? You've been at the Department for International Trade since last July. What specific measures have you introduced there to improve the gender pay gap at that department? And quite apart from the home working that's been going on over the last 4 weeks, do you think you've yet done enough?
So clearly, I work closely with the permanent secretary. I mean, she is responsible for running the department. So, and she is in fact the gender champion across government. So has done a lot of work in terms of promoting flexible working. But what I'm saying is, I think now we can achieve a real step change in the way we implement that in DIT that perhaps we weren't able to before.
As the gender champion across government as she is, and as the Minister for Women and Equalities as you are, were you embarrassed when the Department for International Trade figures came out to show that the gender pay gap had got worse?
I think some of these figures can be a sort of lag effect, if you like, of employment decisions that might have been made in the past. I mean, if you think about it, it's about change over time, Caroline. But what I want to see, and I've made this clear to my permanent secretary, is more females at senior positions within the department.
Thank you. And Kim Johnson wanted to come in on this issue.
Thanks, Chair. I just want to know, do you agree with the citizens' advice and others that statutory sick pay should be very substantially increased? And does the government have any plans to increase SSP? And also, what are your thoughts on universal basic income? Thank you.
So on the subject of statutory sick pay, we have made it available from day one, which was a change since the COVID crisis. And we have also put more money into universal credit. We've raised the local housing allowance as well. So we've made significant changes to the benefit system to support people during the COVID crisis. In terms of a universal basic income, no, I don't support the idea of a universal basic income. It's been tried in other countries around the world. It hasn't been effective. I think the system of universal credit, where there's a single benefit rather than the 6 different benefits that came before, that is tapered off as you do more hours or work more, has been shown to be very effective. And I think, all plaudits to DWP for implementing it so successfully during the COVID crisis. But I certainly don't support a universal basic income.
Thanks. But also there is still a time lag in terms of people accessing universal credit. And Matt Hancock has said that he would struggle surviving on £95 a week. What are your thoughts on that?
Well, my thoughts are that the team at the DWP have done a fantastic job in terms of processing so many new claims, that the system is working well and people are getting access to the support we need. And I think this is an unprecedented international crisis. And I think if you look at the way that the UK benefits system has supported people in comparison to what's happened around the world, actually, we've got a record to be proud of there.
Thanks.
Credit, Secretary of State, do you think there's a case for universal credit to be split in the case of households where somebody's a victim of domestic abuse?
That's an interesting question, Chair. I certainly think that we need to take. We have already launched a campaign on domestic abuse, and we certainly need to make sure that domestic abuse victims are protected. I haven't considered that specific issue about universal credit. I do understand it can be paid to a particular partner if there are issues, but I'm happy to look at that further.
Thank you. And on the subject of domestic abuse, can I bring in Alex Davis-Jones, please?
Thank you, Chair, and thank you, Secretary of State. We know that the government's advice during this pandemic has been stay home, save lives. But tragically, for so many women, staying at home hasn't saved their lives. And we've seen tens of women murdered at the hands of a domestic violence and at the hands of their partner during this pandemic. What strategy was put in place to protect people who don't feel safe in their own homes during this lockdown?
So first of all, we recognised straight away that this was one of the major issues with the lockdown, that it would put domestic violence victims at potentially more risk of abuse. That is why we've been very clear from the start that if you are a victim of domestic abuse, the rules about lockdown, the stay-at-home message does not apply. You should leave that home if you're able to. We've also launched the campaign and the National Domestic Abuse Helpline number, which is 0808 2000 247, and people should ring that with a view to getting the help they need. We're extremely worried about this problem. We've launched the You Are Not Alone campaign to help people get the support that they need. But be absolutely clear, the rules of lockdown that you're talking about do not apply. If you are in a domestic abuse situation, you should absolutely be able to leave that property where you are facing domestic abuse.
So before all this began, before the lockdown started, many members of the House, many charities and third sector people were calling on cross-party talks to ensure that a strategy was put in place. Did these happen? When did you first have these conversations with the Home Secretary, for example, and third sector charities to support people in this situation?
So these conversations took place before the lockdown. We were aware that one of the major issues in a lockdown situation would be domestic violence and the threat of domestic violence. So those plans were immediately worked on, particularly by the Home Office, but other departments as well. It was a conversation that was held around government. Of course, the Home Office is working with domestic violence charities like Refuge, and also with local authorities to make sure that victims of domestic violence do have somewhere to go and make sure that they have the support they need. But this has certainly been something that all government ministers have been very, very aware of as being a really major issue. We have listened to what people in Parliament have said about this issue.
So do you ask for regular updates on this from other departments? What progress has been made by the different departments to make sure that women are kept safe? Who other than the Home Secretary have you been speaking to on this?
Well, we keep regular updates in terms of the figures from the Home Secretary. I've also had discussions myself with my local police chief about the issues affecting Norfolk on this. And we are working really hard as a government. I know that Robert Jenrick, the Department of Communities and Local Government, is also working on this issue and making sure people have the support. The key point about the campaign, the You Are Not Alone campaign, is really raising awareness amongst victims that there are people on their side, that they should call the helpline, that if people are in desperate need, they should call 999 and press 55 if they're not able to speak, to get that support. But the real key things is getting those victims to come forward. I know the police are doing a lot of work in terms of trying to identify where there may be potential issues. This is really connected with the issues of children not coming into school as well, making sure that those families are getting the advice and support that they need. But it really is a cross-government effort, and we are all very concerned about it.
So how
we discussed at a number of cabinet meetings, for example. I mean, I can't get you the exact details, but there has been discussions on
and you've been involved in those discussions?
Yes, absolutely.
Okay. How confident are you that if a woman phones the helpline, she would be given help and she would be able to access that support if she needed to flee her home?
Very confident.
Very confident. Okay. Currently, we've been told that 60% of women are being turned away from refuge, and refuge workers and volunteers aren't classed as essential workers during this crisis. Were you aware of that? What conversations have you had with refugees and to support these people when they're fleeing their homes?
So I wasn't aware that refuge workers were not classified as key workers, and I will certainly look into that issue. But I have been in touch with the Department of Communities and Local Government, who have assured me that when people ring that helpline, there will be accommodation found for those people, and they're looking at all possible options for that accommodation.
Because we're aware that obviously the Ministry of Housing, Communities and Local Government, they've been asked to help for emergency accommodation. They've got emergency accommodation providers offering them support. What conversations have you had with the department, with Robert Jenrick, to ensure that emergency accommodation is available for these women fleeing their homes?
Well, as I've said, I've been in touch with the department and they have assured me that that is absolutely happening when that number gets called. But I can absolutely go and look at data on, exactly what's happened. But I have been assured that that will be in place.
Right. Okay. Thank you. Yeah.
Sorry, Alex, just more questions.
And thank you.
Can I bring in Kim Johnson at that point, who also wanted to talk about domestic abuse of a different kind?
And again, thank you, Secretary of State. My question was elder abuse, the fact that a lot of centres in local authority have been closed, particularly dementia hubs. And I think, looking after somebody with dementia 24/7 in a lockdown situation can increase the propensity for elder abuse. So I was just wanting your thoughts on that and what can be done to look at the issues in terms of elder abuse. Thank you.
Thank you very much for that. We do have specific policies in place for the elderly in terms of the additional shielding that's being provided, the additional support from local authorities. In terms of cases of elder abuse, that is something I can certainly look into, but I don't have any data on that at the moment.
Thank you.
Can I bring Nikki Aitken back in, please?
State, obviously in crises like this, governments, local authorities, businesses learn how to do things better, or it just educates them in how they go forward. What have you and your department discovered or learnt from this pandemic so far in the case of domestic abuse and our response to it that could now be directed towards the domestic abuse bill or could be addressed in the forthcoming domestic abuse bill?
It's a very good question about what we've learnt. I think it's quite early on in terms of monitoring those cases to be able to make any definitive comments, but it certainly is something that we will be looking at. I mean, I think more broadly, there are all kinds of things we can learn about how government can operate more digitally, that we can certainly put in place for future. I think it's opened up new ways of doing things. I certainly know the police are looking at how they, in this time of lockdown, it can be difficult to get information about where domestic abuse is occurring. And I know the police are looking at different ideas, whether that's working more closely with schools and other authorities to get more early warning indicators. But certainly that is something that we will look at. I mean, just to be clear to the committee, I mean, the whole government is pretty much 24/7 on supporting people during the COVID crisis, and an awful lot of aspects of that. And necessarily, we've had to move fast to do things like put extra funding in, launch campaigns, making sure those key operational parts of our response are in place. And as we move forward, there will be more time for data gathering and analysis. And that is why I've asked for this data, but we are at the early stages of doing that, because the first phase was very much all hands to the pump, make sure that we've got the core in place to save lives, but also protect people in the home from domestic violence, and make sure that we are keeping the economy going as best we can, because of course it's really important that we keep people in jobs through and after the crisis. So inevitably some of that analytical work will take a bit longer, but we will certainly be looking at that at GEO about what we can learn about how we've operated in this crisis and what we can do in future.
Can I bring Peter Gibson in now, please?
Good morning, Secretary of State.
Good morning.
We've seen changes in the coronavirus bill to the obligations of care from local authorities, and I just wondered if you could please explain to us how that's being monitored, what additional resources are being given to local government to deal with social care, particularly for those isolated, disabled people who are receiving that care at the time.
The reasons that we had to make those changes in the coronavirus bill was giving the flexibility to local authorities to prioritise those most in need. And we have given additional resources to local authorities to be able to do that. In terms of the feedback we're getting from local authorities, that is something that we will receive over time, but there are clear safeguards in place in terms of making it happen in the world, but I have not yet seen any data out of
so
that.
Is there any monitoring going on at this point?
Well, there will be monitoring by the individual local authorities taking place.
Okay. There was also changes in the coronavirus bill in respect of mental health and the sectioning provisions in that. Is the assessment of government at this stage that they were necessary? How extensively are they being used? And at what time will they be changed back?
Well, we're very clear these were temporary measures to deal with the immediate crisis. And, we will look at changing those temporary measures when the time is right, but they are very much temporary, they're not permanent. In terms of monitoring that, that's the responsibility of the Department of Health. I would suggest to you probably that it's a fairly early stage for getting that data and analysis, but certainly it's something that we can look at with the Department of Health.
So do you think that they were essential?
Well, I think it's too early to say is the answer. We're operating in real time at the moment with day-to-day decisions being made. I think once we're through the most difficult part of the crisis, that will be the time when we can analyse whether those flexibilities, but just to be clear about these flexibilities, they don't have to be used. We were giving health authorities, in the case of the care work, local government, the decision-making power to be able to use those flexibilities if they have to. They may not have to use them. It would be good if they didn't have to use them. But I think it was right that we made sure that everything was in place to run the best possible operation with the ultimate objective of saving lives at this really difficult time. I mean, we talked a bit earlier about the disease. The fact is the disease is not fully understood. It's not fully predictable. And that inevitably means that you are going to have to put in place contingencies that don't necessarily get used. But rather than not having those contingencies in place in first, I think it's important to be able to have that flexibility should it be needed. So even if it weren't used, is what I'm saying, Peter, it still might have been the right thing to do to put it in place.
What do you see your role during the pandemic in respect of those people who are elderly or disabled?
Well, of course, I work on equalities policy for the disabled, but we've also got the disability unit at number 10, and we've got in the Cabinet Office, and we've also got DWP with specific responsibility for disabled people. So I see my role as making sure that disabled people are not being discriminated against during the crisis, and that we are specifically protecting them in terms of saving lives, in terms of protecting them during the lockdown, and in terms of the recovery. So making sure that disabled people are a full part of the economic recovery and don't get left behind in the same way that is true of disadvantaged groups across society. I think it's important to recognise, though, that the implementation of those policies rests with the relevant departments, but I see my role as having an overview of that.
Okay. Many people who have protected characteristics that fall within your remit are already isolated, and I'm thinking particularly here in respect of people who have communication difficulties, such as the deaf and the blind. Do you think that the government, in terms of its communication, is doing enough to get the coronavirus messages through to those people? And also, is enough being done to people who speak different languages to ensure that the coronavirus messages are reaching those communities where people speak languages other than English?
So in terms of messages to people with disabilities, there has been work by the disabilities unit to make sure that we have appropriate sign language, for example, that we have appropriate communications for people with disabilities on the core coronavirus message. That is the responsibility of the Cabinet Office. In terms of the message to wider communities, that really lies with the Department of Communities and Local Government, but I know that they are working very hard to make sure that the appropriate language is used to communicate with those communities. So it's a cross-government effort to make sure that we communicate with everybody.
And have you done any assessment of whether those messages are actually reaching those people at this particular time?
So we definitely have looked at whether those messages are going out, and they certainly are. In terms of audience reception, that would be a matter for the head of communications. I'm certainly happy to look at that. I know that we're doing general research on how the messages have got across to the public. So I'm certainly happy to look at that issue specifically.
And I just would like to touch on the issue of domestic violence in LGBTQ communities. We appear to have had a spike in reported cases there. What specifically are you doing to monitor that?
That is being monitored alongside the overall work on domestic violence by the Home Office.
And do you think that that particular community requires a different messaging from the normal domestic violence messaging that's been coming out from the government?
I think that's an interesting question. I think our overall domestic violence messaging is very inclusive, is the way I would put it.
I have no further questions, Chair. Thank you, Secretary of State.
Thank you, Peter. Can I just follow up on one of Peter's questions about the accessibility of information, and particularly the letter from the PM, which went to many, not all households. I'm sure, like me, you've had constituents complain they've not received it. That wasn't particularly accessible for those who might have learning difficulties, for those of visual impairment. Are there any plans to have more easily accessible, perhaps an easy read version of that go out?
I don't know is the answer. I'd be happy to look into that. There have been, as I say, through various different channels, messages going out, but I think probably not that specific message.
Thank you. Can I bring in Sarah Brickcliffe now, please?
Hi, thank you, Chair. I would just like to go back to Peter's point and talk about whether you share the concerns of disability organisations that the BMA's guidelines for healthcare professionals faced with difficult decisions about who to treat in an intensive care could result in discrimination against disabled and elderly people.
Well, we're very clear there should be no discrimination. That is a decision for individuals and their families, and we've been very clear about that.
So what can the government do to ensure that this doesn't happen?
Well, we need to rely on our medical professionals to make sure that is implemented correctly.
And have you a role in this to play? Have you been speaking with the Health Secretary about this? As you can imagine, when reading the BMA's guidelines, it can put worry in people's minds, especially when they speak of higher survival probability and people may be denied intensive care.
I think the work that the health department has done to increase capacity in the system has meant that we are able to provide everybody with care who needs it. And I think that is absolutely right. In terms of specific conversations, I'm aware of the general issue, but I haven't specifically discussed that with the Health Secretary because I am confident the advice is very clear that there should be no discrimination.
No further questions, thank you.
Can I bring in Kate Osborne now, please?
Good morning, Secretary of State.
Morning.
I want to focus my questions around the LGBT plus community. The LGBT Foundation and other organisations such as Stonewall have been conducting research on the impact of Covid-19 and the LGBT plus community. And they have suggested that the virus may be disproportionately affect groups such as LGBT plus people who already experience poorer outcomes in healthcare. So we've heard, can you tell us please how you've been engaging with LGBT stakeholders, and do you think that there are specific actions that the government can and should take?
Well, in terms of the data, I'd be very interested to see the data you've had and to have a look at that, and we can consider that in the Government Equalities Office. I have, during the crisis, made sure that we have the proper LGBT healthcare advisor in place. I'm sure Helen Cook can give you a bit more detail about that if I hand over to her, but we have been involved with the health department, making sure that LGBT advice is specifically in place to make sure that LGBT people are not specifically in a difficult position because of this crisis. Helen, can I bring you in on that?
Yes, I think that's exactly right. We of course have the healthcare advisor, Dr. Michael Brady, and very good news that we were able to kind of keep on funding him, and he'll be in place for another year now, and he is working specifically on this issue. I wasn't aware of specific data around different health outcomes for LGBT people, so I think we would be really interested to see that. But that work is certainly going on.
Can I come back now? Thank you. And as Helen said, we made that decision just as the extent of the coronavirus crisis was becoming clear. We made that decision to fund that from the GEO budget because we thought it was a really important priority early on. And Kate, I can commit to you that I'm happy to speak to LGBTQ stakeholders on this specific issue following this committee meeting. So I'm very happy to talk to them in more detail after that.
Thank you, Secretary of State. That commitment is very, very welcome. Can I move on to talking about social isolation? And this can have a greater impact on LGBT people due to their circumstances and experiences, because LGBT people are more likely to be socially isolated and therefore may not have the same networks to rely upon if they feel ill. And as Peter's mentioned, also are at the risk of domestic violence. And I just wondered what you can tell us in terms of what support is being offered specifically around these issues.
I know that my department is working very closely with LGBT stakeholders on this, and we're also working with the Department of Communities and Local Government. I mean, we are making sure, and this is back to my original point about making sure everybody across the community is protected. Everybody has been affected. There are some people in particularly vulnerable positions. There are some people who are being shielded, so are even more isolated than others. And we are doing everything we can to make sure people get that support, regardless of their sexuality, their gender, their age, or their disability. We are working as a government to make sure everybody has that support.
Thank you. And the LGBT sector is beginning to show that increasing numbers of LGBT people are seeking support from specialist organisations, often charities, that are already coming under an awful lot of strain in the situation that we're in. Again, can I ask what support you can offer to these organisations and charities that LGBT people rely on so much?
You'll be aware that a announcement was made by the Chancellor and the Culture Secretary about an overall, I think 750 million pounds to be provided to the charitable sector to help them do the work. And obviously LGBT charities are part of that. And if there are any issues in those charities accessing that funding, they should get in touch with me, and obviously we can push that from the GEO.
Okay, thank you. Thank you, Chair.
Can I bring in Kim Johnson now, please?
Home Secretary, there has been lots of coverage recently about the high deaths of Black people as a result of COVID-19. And the first 10 doctors that died were from the BAME community. So what I'd like to know is, how concerned are you about these high levels of deaths?
Well, I'm very concerned to hear these reports, and I've had discussions with the Race Disparity Unit and the Chief Medical Officer in Public Health England about really establishing what the data is showing us about the impact on BME communities of this virus. So we've already started that work. We don't yet have the data to really show us exactly what the situation is or why the situation has come about, but that is something we are certainly working on.
Thanks. Robert Jenrick mentioned recently that Downing Street would be undertaking an investigation. Can you say a little bit about that and what role GEO will play in it?
Well, that's exactly what I was talking about, that work that is taking place, and we are a key part of that. Really as part of the Equalities Hub, which encompasses GEO, the RDU and the DU, together with Public Health England and the Chief Medical Officer.
I think you've just mentioned that there is an issue in terms of how information is collated and the fact that there doesn't appear to be a consistent process in gathering ethnicity data. You know, so will that be happening now? And can you tell me whether death certificates will start to identify ethnicity?
So it's certainly something that I've identified at GEO and the Equalities Hub overall, is we don't have strong enough data. And also we need more staff who are specialists in data gathering and research. And that is something I'm working on with Theo Agnew to make sure that we have a really strong set of data. Of course, about race, gender, and LGBT status, but also on other issues like geography, background. How do we understand that across the piece so we can really see the impact of policies overall? We kicked that off some time ago. COVID has made that even more important for these specific issues around health. In terms of the death certificates, I believe that's something that is being looked at the moment. But certainly, I think it's better to have more data so that we fully understand this issue. And the way I see it is there are three stages to this. There is the impact of the disease on specific communities across Britain. Then there is the impact of the lockdown on specific communities. And then there is also how do we see the recovery working for people across the UK. And GEO is involved in all three of those stages. And what I think is really important is we don't forget the recovery part. So how are we going to make sure that the economic effects are not disproportionately difficult for people from BME backgrounds, which, when we're looking at ending the lockdown and economic recovery and which parts of the economy are open first, we need to be looking at the impact on everybody across the UK, making sure people have equal opportunities, making sure people are discriminated against. So I want better data, and I've asked for better data on all three of those things. And we've got some data, but it is patchy, and it certainly needs to be better. And I think this is the way that I see the Equalities Unit working in future, is much more of a central hub, much better data sharing with departments, so we have that data much quicker as things move through. Okay,
thanks. We find that working class black women with underlying health conditions due to socio-economic reasons are more likely to work in the care sector. So what's being done to risk assess these vulnerable workers and ensuring they're shielded?
Well, we're making sure that we have proper protection for everybody in the care sector. But I think your point really is the point I was making earlier, which we need to be looking at sort of backgrounds, socioeconomic status, geography, as well as race, gender, sexuality, so that we have a full picture. Because what is the case is that it's often particular geographical locations or particularly groups that can be hard hit. And certainly when we're looking at the economic recovery, we need to make sure that it is part of our agenda of levelling up Britain. And we're not finding that places already relatively suffering economically end up suffering more as a result of the recovery. So we need to make sure that we are supporting people right across the country. We're supporting people of all backgrounds, all ethnicities.
Okay, thank you. And what role do you think that unconscious bias plays in these high rates of deaths from Black people?
That is a very hard question to answer before we have any data. And, we don't know the reasons. I think the first point is getting the proper data and then really understanding the reasons. And as I say, we need a fuller understanding of the disease itself and how it operates to get to the bottom of that.
Okay. And lastly, what's your opinion about compensation for the families of those people that have died due to the lack of protection that's being available to key workers?
Well, we do have protection in place for key workers, and we are making sure that we can get that protection to people. My view is that our focus now should be on making sure people are properly protected.
Okay, that's all my questions. Thank you.
Thank you very much, Kim. Can I bring in Peter Gibson, please?
Thank you, Chair. Secretary of State, you referred to the charity packages that have been announced by the Chancellor, and some of those monies have been allocated to deal with domestic violence charities. I wonder if you could take away and return to us, or highlight to your colleagues, the apparent difficulties that charities are having in accessing that. That there seems to be some confusion as to whether the Home Office or MCHLG are dealing with that, and how individual refugees can access those funds through that. If you could take that away, please.
I'm very happy to look at that, yes.
Alex, please, who had a follow-up question.
Thank you, Chair. My question, Secretary of State, follows on from Kim's questioning regarding unconscious bias in the disproportionate number of deaths in the BAM community as a result of coronavirus. So yesterday, the Welsh Health Minister, Vaughan Gething, announced there would be an inquiry in Wales into why this is happening and why the BAE community seem to be so disproportionately impacted. Will the same be happening in England?
As I've said, we're already launching work with the Racial Disparity Unit, the CMO, and Public Health England on precisely this issue, understanding first of all what the data is, and then understanding why it is the case.
Okay, thank you.
Can I bring in Angela Crawley now, please?
Thank you, Secretary of State. Now, obviously this is a difficult time for many people, and the long-term impact or the economic impact will be significant. So as the Minister for Unequalities, how has this pandemic affected government's strategic equality objectives, and have those priorities shifted, and how much has that impacted on the Government Equalities Office day-to-day work and focus?
So first of all, alongside the work the Government Equalities Office is doing, supporting departments with equalities assessments, some of the issues we've been talking about already around data gathering and better analysis, the Government Equalities Office staff have also been assisting other departments. So we've had some of our team supporting the Department of Health, some of our team supporting the Foreign Office, helping people get repatriated, some supporting press inquiries, all kinds of things. And across government, all hands are to the pump, dealing with this really unprecedented crisis and making sure that we are saving lives as we need to at this difficult time. So I just wanted to make clear that the Government Equalities Office is focused on supporting the wider government effort along with its key duties. As we exit this immediate crisis, I already said that one of my focuses of policy was economic empowerment. I think that becomes increasingly important because of the difficult economic position the country will be in, that we make sure that people are able to access high quality jobs, that businesses have opportunities. The Chancellor recently announced a package to support tech industries where women are actually disproportionately represented in terms of business ownership, and making sure that that recovery package and the way that we exit lockdown benefits everybody, regardless of your gender, your ethnicity, your background, is going to be incredibly important. So the way I would put it is, I think what was a long-term agenda in terms of economic empowerment for women has become a lot more urgent. And we're now looking at with respect to the economic recovery post-COVID.
Okay, on that point about economic empowerment, the government made the decision to suspend gender pay gap recording and enforcement for a large number of employers. Now, are you personally comfortable with this decision, and why not merely extend the deadline rather than stop the recording of gender pay gap?
What we've done across the board is make sure that companies are not facing additional burdens to their core business, because our number one priority is keeping those companies going and keeping people in work. And if we end up in a situation where people are being laid off, whether they're women, BAME people, because companies couldn't stay afloat, then that to me is a big problem. Of course, dealing with the gender pay gap is important, but the most important thing is that we keep people in employment in the first place and we keep the economy going, because without that, without people having jobs, we will be in serious trouble. So it's a recognition at this time, and we've made various allowances in terms of reporting of data, in terms of some of the rules and regulations for companies to allow them to focus on that core business. And that is why it's a very important priority as we exit lockdown to make sure that we are supporting companies, keeping staff employed, re-employing people, and that should be where their priority is focused. And as to your question about extending the deadline, the issue is we don't know quite how long this will last. We don't know in exactly what form it will last. So it's very difficult to say we're extending the deadline for X period or Y period. I think it's better to pause it while we focus on this emergency situation of keeping our economy going and keeping people in jobs, and then re-look at it once we're through the immediate crisis. And as I say, the focus at GEO is going to be making sure that women aren't disadvantaged in the course of the recovery, that BAME people aren't disadvantaged in the course of the recovery, and that nobody is disadvantaged in the course of recovery. That is going to take all of our energy, and I think that's going to take all of the energy of companies as well.
Okay, you have stressed the importance of data. Now, given the disproportionate impact and the effect it will have on many women during this pandemic, isn't it particularly important to have gender pay gap data? So even if it had been delayed, would that not have been more beneficial to the government in the long term? And are you not concerned that the blanket suspension of enforcement and the message that sends that you're not taking the gender pay gap seriously?
I think the very clear message we're sending to companies is that the number one priority is that they stay in business and they keep people employed. And I think it's incredibly important to recognise that this is a national and international crisis we're dealing with. This is not business as usual. And we do want companies to be able to focus on that core job. I speak to lots of businesses in my role as GEO minister, but also as trade secretary. And businesses are under severe pressure at the moment. I think we need to recognise that. And it's right that their focus at the moment is keeping their business going and making sure they retain those jobs. We will absolutely focus on the issue of differentials in pay, occupational segregation, which I was discussing earlier, in due course. But at the moment, it is all hands to the pump. And that is the message we want to give to companies.
Okay, thank you. I have one more question specifically on universal basic income. Now, you mentioned that other countries had tried this that hadn't been effective. Now, are you aware that many of the countries that have tried this on a regional basis, and it was argued that while aspects of this had varying degrees of success, it would need to be applied nationally to have any sort of ability to have an impact? So could you consider the UK to be the first country in which they could roll this out nationally, and would you consider universal basic income as a possibility for the UK to roll out in the long term to mitigate against the impact of this pandemic?
We've introduced emergency measures such as the furlough scheme during this crisis and the the addition to universal credit during the crisis to help us get through the crisis. But I don't think we should confuse economic measures that we put in place during the crisis for the future of our economy. And I'm against universal basic income in principle, because what it does is it reduces the incentives for people to go to work. I think universal credit has been incredibly successful because it's helping people get their hours up, make sure that the work always pays. I think where it's been tried, universal basic income has not delivered that, and has instead resulted in economic problems. And at the heart of this, why is it that we are able to pay for the furlough scheme? Why are we able to pay for the universal credit system? The answer is we've got businesses out there who are trading, who are making money for our country, which is why we can afford public services to pay for things. And if we damage that system by diluting the incentive to go into work, then ultimately we'll all pay the cost of that.
Looks like Angela might be frozen. I think that was her last question. Can I now bring in Sarah Brickliffe?
The beginning, you mentioned the Gender Recognition Act and stated that we would see progress in the summer on this. Can you just elaborate on what progress you're talking about there, please?
So before the summer, we will make an announcement on our response to the consultation and how we're going to proceed on the Gender Recognition Act. So that's before the summer recess.
Okay. And other important equality objectives, do you believe the pandemic will further delay those too?
In terms of the Gender Recognition Act, we've obviously had a lot of work to do. We've now completed that work. So we want to get on with announcing that so that transgender adults can have the security and know that they've got the ability to live their lives freely. At the same time, making sure we protect single-sex spaces, at the same time, making sure we're protecting the under 18s from making irreversible decisions. So that has not been, I would say, delayed by the crisis so much as, obviously it's been difficult over the last few weeks when the entire government energy has been focused on COVID and Parliament has not been operating to make those specific types of announcements. In terms of our other work, as I've said, I think the economic empowerment work has now become more urgent as a result of the need to make sure that we have the right sort of recovery in our economy, and that is a recovery that delivers equal opportunities for everybody. So that has probably brought forward some of the department's work on that front.
And just going to the Good Parliament report, how far do you think the House of Commons has progressed in introducing the recommendations in the Good Parliament report? And is there more that you'd like to see done on this?
Well, I was one of the MPs in 2010 who lobbied for changes in the parliamentary hours because I thought they were ludicrous. And we did succeed in some reform of bringing forward some of the evenings and making it more like a normal working day. I think there's further Parliament could go. I still think it's the case that we don't operate in a modern enough way. I think that I'm very pleased with what the Speaker's done in terms of the hybrid Parliament we're operating now. But what I'd like to see us do is learn some of the lessons about how we can do things differently, how we can both support our constituents, but also participate in Parliament in a more flexible way. And I don't think we should just go back to business as usual after we exit this crisis. I think we need to think about how can we do things differently. And I think that's a key part of attracting a wider variety of people to serve in Parliament and serve as MPs. I still think we're not good enough at attracting a wide enough variety of people. I think we've got better, but I think we should use this opportunity to do things differently in Parliament. I do hope that's something that the Women and Equalities Select Committee can have a very important role in pushing forward.
And will you commence Section 106 of the Equality Act as recommended by the report?
I'd have to look into that in more detail.
Okay, thank you.
Thank you, Sarah. I think Kim now wants to come back in, please.
Thanks again, Chair. Picking up on some of the BAME issues earlier, just wanting to know whether the race disparity audit would be updated given that it was first published in 2017. Thank you.
Thank you. Well, that is really a matter for Theo Agnew at the Cabinet Office. But of course, what I'm doing is working with him on this overall equality hub where everybody is going to be co-located. And my view, broadly speaking, is that we should be making data available, and that should be the primary role of the Equalities Hub, is making sure everybody has equal access to the facts.
Thanks, Secretary. Do you have any idea in terms of timescales when you're hoping for this Equality Hub to be up and running and in place?
Well, I pretty much press Helen every day on getting it to happen. So maybe I'll just pass over to her to see where we are.
Thank you.
Thank you. Yeah, that's certainly true. I think the units are already working much more closely together than they were, which is fantastic. And I think the Secretary of State outlined at the start her plans to kind of bring us together even more, to help us join up more with what we're doing, to share resources. And I think bringing us all together physically would certainly help with that. Although, as we have all shown for the last 4 weeks, we can also work really well remotely. So I think we've probably got fewer excuses on that front when we get back.
Thank you.
Thank you. Well, our Kate Osborne would like to come in now as well.
Thank you, Chair. Secretary of State, you've mentioned a couple of times that the under 18s need to be protected from irreversible decisions. Can you tell us more about this, what you plan to put in place and also to achieve this, and also who you will be working with specifically around the trans community?
So in terms of the under 18s, I mean, my fundamental view is that grown adults should be able to make decisions, to have agency, to live life as they see fit. But before the age of 18, when people are still developing their decision-making capabilities, they should be protected from making decisions that are irreversible about their bodies that they could possibly regret in the future. And this is work that we are currently carrying out. It's mainly led by the Department of Health, particularly in the area of transgender. But what I was doing to the committee is outlining the fundamental principle, which is going to guide our work, both through the Department of Health and through the work we're doing on the Gender Recognition Act. The Gender Recognition Act is clearly about the over 18s, so it's not specifically relevant, but I think it's an important distinction that we make. In terms of who we will talk to and consult with, of course, we are happy to speak to everybody, and the Department of Health are as well. I'd be happy to have follow-up conversations in advance of our announcements on the Gender Recognition Act.
And I suppose a request, if you like, would be that you also bring on board specialists, people that can input into this around mental health as well.
Yeah. And this is precisely the work the Department of Health are doing. And back to the point I was making initially, the GO clearly has a very important role at the centre here, but the Department of Health are the experts in terms of mental health, in terms of helping people manage these situations. So they are very much taking the lead on that part of the policy.
Thank you, Chair.
And we've got a bit of time, so I have some final questions, which might appear a little scattergun in nature. Firstly, you've spoken a lot about the recovery and about the role of women in the economy as part of that recovery. Can I ask a question about the availability of childcare and whether you have any concerns about the availability of good quality childcare at the end of this crisis, and what representations you've made to the DfE about support for that sector?
So, yes, childcare is clearly an issue for people. I think it's incredibly tough at the moment for many families through this crisis, getting on with work at home, whilst often supporting their children doing virtual learning. I know I've got 2 of my children doing virtual learning as we're on this committee call, probably using up all the broadband that we're meant to. So it is tough for families, there's no doubt about that. I think the work the Department of Education has done in keeping open schools for key workers and vulnerable children is very interesting. And I've long been a proponent, since I actually had the role of childcare minister at the DfE, of schools offering more support for parents. And I think be a useful thing to look after the crisis about how much more of that we can do. It's certainly a discussion I've had with the Education Secretary. I know that he's an enthusiast for schools providing more of that sort of support. So I'm very interested in that idea. I'm also interested in the idea of how can we change the culture of offices to move away from presenteeism, to move towards more flexible working, and to integrate families more in the lives we all lead. I mean, it's noticeable now that I have conversations with chief executives and their children are sort of moving into the room or whatever. And I think people are more open about the role of family life in the workplace than they were before. And I think that's a positive change. I think previously it was something that senior executives felt they had to hide away. And I think so as well as making sure that childcare is more flexible and supportive of parents, we also need to make sure the workplace is more flexible and supportive of parents too. It can't just be a one-way street.
Specifically about early years, you've mentioned schools and the role that they've played, and I think they've done a brilliant job across the country in making sure that key workers' children are looked after. But have you made any representation to the DfE about the early years sector, the current position that they are facing with funding, and are you concerned about the viability of that sector, which is so crucial to enabling particularly mothers to go back to work after maternity leave?
Well, so I know Vicky Ford has done a lot of work as early years minister in terms of supporting the nursery and childcare sector. And I think that's something that should be looked at by the DfE. And certainly I will talk to them as we approach the economic recovery, because with more parents going back to work, we're going to need to make sure we've got childcare provision in place, both for the early years and at school level.
Completely different subject. At the beginning of this crisis, the Department of Health seemed to go through a rotation of about 360 degrees on the issue of access to early medical abortions via either video consultation or telephone consultation. What representations did you make to the Secretary of State for Health during that process?
Well, I fully support the policy position we have now reached, which is making sure that women have access to those services.
That wasn't actually the question I asked. Did you make any representation to the Secretary of State during that process?
I did discuss it as the answer, and I'm fully supportive of where we've got to.
So you made representations to him when he pulled back on that position at the very outset of the crisis?
Well, I'm not going to reveal my internal discussions with other government ministers. I'm fully supportive of the position, and I think it's right that women have access to those services.
Thank you. On the National Disability Strategy, is there yet a timetable in place for that?
I'd have to check on that. That is something that is being led through the disabilities unit, but I will certainly check up on that.
It would be useful if you could let us know. And finally, throughout this committee session, you have made reference to the availability of data, the work that is ongoing in collating that, and the fact that it may well take some time, months, for some of the impacts, possibly years, for us to fully understand the impact that Covid-19 has had on different communities, different sections of society. I think our inquiry into coronavirus is very much a first step, and I've always been conscious that we may well wish to come back and review the decisions taken, the impacts, both short and long term. And given your enthusiasm for the data collection and understanding that better, would you be happy to come back and talk to us about that when you've had a chance to both gather the data and analyse it?
So I certainly will be. And what we will be doing is making sure that you're updated as soon as we get the relevant data on the issues we've outlined. I can assure you that I am constantly banging the door for data for the rest of government. And when I do get hold of that data, I'll make sure that we pass it on to the committee.
Thank you very much, Secretary of State. Can I conclude by thanking everybody for their participation? This was our first attempt at an evidence session via Zoom. I think it's worked very well. I think the Secretary of State has made some very interesting points about how Parliament may function in the future, and certainly as a first attempt, I think this has gone really very well.
Very well.
This concludes the evidence session, and I would like to thank all of you for having taken part, and look forward to seeing you all virtually at the next meeting. Thank you.
Thank you.
There's an elephant in the room.